Understanding Panadol and its potential side effects. Worried about side effects from Panadol? Let's break down what you need to know to use it safely and effectively. Panadol, also known as acetaminophen or paracetamol, is a common over-the-counter medication used to relieve pain and reduce fever. It's a staple in many households for treating headaches, muscle aches, and cold symptoms. It works by blocking pain signals in the brain and helping to regulate body temperature. While generally safe, it's important to be aware of potential side effects. Most people tolerate Panadol well, but side effects can occur, especially with high doses or prolonged use. Common side effects are rare but can include nausea or abdominal pain. In rare cases, more serious side effects like liver damage can occur, particularly if you exceed the recommended dosage or combine it with alcohol. Allergic reactions, though uncommon, are also possible. Always follow the dosage instructions on the packaging or as directed by your doctor. Never exceed the recommended dose, and avoid using Panadol for extended periods without consulting a healthcare professional. If you have liver problems, kidney issues, or a history of alcohol abuse, talk to your doctor before using Panadol. Be mindful of other medications you're taking, as some may interact with Panadol. If you experience any unusual symptoms after taking Panadol, such as skin rash, difficulty breathing, or yellowing of the skin or eyes, seek immediate medical attention. These could be signs of a serious allergic reaction or liver damage. Don't hesitate to contact your doctor or pharmacist if you have any concerns about Panadol or